Hello, good evening, everyone. Hello. Welcome to the Direct Examination Justice Unveiled Edition podcast and Facebook Live. This is being streamed on Facebook Live. All of you who are listening, especially on the podcast, are probably thinking, wait a second, did I download the wrong podcast? Because this does not sound like Joseph Bias. Don't despair, everyone. You're in the right place. You are listening to the first episode of the Direct Examination podcast, Justice Unveiled Edition, featuring South Carolina for criminal justice reform. My name is Allie Menigakis, and you may have heard me on some of the episodes from this past year talking about criminal justice issues. You probably heard our Associate Director, Donna White, who's also going to be joining us tonight. We are so grateful to Joseph Bias, Dane Phillips, and Amber Fulmer for allowing us to hijack their incredible podcast for the summer and force you all to listen to us talk about criminal justice issues in South Carolina. Don't worry, we'll try our best to make it fun and interesting. The OG hosts will likely come back for an episode here and there throughout the summer, but for now, you are ours. So what is SC4CJR and why in the world would Joseph, Dane, and Amber let us take over? Well, SC4CJR is a statewide, nonpartisan, nonprofit organization dedicated to achieving holistic criminal justice reform in South Carolina through research, education, collaboration, and advocacy. We are unique in that we take a multidisciplinary approach to reform. Our team is made up of individuals who have been victims of the criminal justice system, like formerly incarcerated individuals, those who have worked in the system, like public defenders, mental health professionals, former police officers, former prosecutors, and then those who study the system, like academics and researchers. And we all come together to identify problems in the system, educate the public on these problems, and work together to create smart solutions. Speaking of smart, I'm so grateful to be joined today by my awesome director, Donna White. We're supposed to have Philip Berry joining us, but he's stuck. Hopefully he'll be able to join us later. But I'm gonna let Donna go ahead and introduce yourselves, tell us why you are part of our organization and what you do and your expertise.
So like Allie said, I am Donna White, and I am the Associate Director for SC4CJR, and I'm a behavioral therapist. I specialize in substance use and mental health, and I've been doing that for longer than I can remember, but it's been 15 plus years. And I know, right? It's crazy. Got involved with SC4CJR because I'm really passionate about criminal justice, and I like to look at how mental health and behavioral health, so mental health and substance use disorders, intersect with the criminal justice system. Yep. That's me.
Donna, and it's going to be so fitting for this month. We are focusing on mental health, but we're going to get into that in a little bit. Also, we would have had, and he'll hopefully be joining us in the next episode, and maybe he'll be joining us late, Philip Berry, who is our Director of Research. He is a criminologist out of the University of South Carolina, and he knows all of the data and all of the research goodies when it comes to criminal justice systems, especially when it comes to policing issues. And June is going to be Policing and the Criminal Justice System month. So Philip is going to have a lot of great stuff to talk about then with y'all, and have some awesome hosts. Now, this month is Mental Health Awareness Month, right, Donna?
Yep.
And
Absolutely.
All of you who follow us at SC4CJR social media and our website know that we like to dedicate different months to different issues in our system. And so, I lost you, here we go. We like to dedicate each month to different issues in our criminal justice system. And the past few months, we have been focusing on the death penalty in South Carolina. And it is only fitting that we discuss that again briefly today, because it's very relevant, and a lot of crazy stuff has been happening in South Carolina in just the past few days. So we do want to take a moment to discuss that before we introduce our illustrious guests here. So there's some good stuff and bad stuff that's been happening in Columbia. Let's start with the good stuff, Donna. Let's start with yesterday.
And yesterday was awesome.
Yesterday was awesome. Yesterday, Don and I, we got in the car, we drove out to Columbia bright and early, and we were able to testify before the South Carolina Senate Labor, Commerce, and Industry Committee in support of Senate Bill 295, which prohibits professional boards from solely denying a license application based upon an applicant's prior criminal conviction. And after we testified, and thanks to Lester Young and Candace from AFP and others who testified before the senators there, the committee voted unanimously in favor of the bill. So it's hopefully going to be heard before the Senate soon for a final vote. But Donna, how awesome was that?
It was a pretty awesome experience. I mean, to be able to sit there and talk with the senators and other people in the room about the need for, us to look at the current system and allowing people to become licensed and giving people that second chance, or as we called it, the first chance, and then we were told it was a second chance again. But for people to be able to have another chance to get a business going, to start their lives over after, recovery, and
yeah,
pretty amazing.
It was, this bill is so important, and we commend the senators that proposed it initially. But as Donna, and I think I forgot to introduce myself, I'm Allie Menigakis. I'm the executive director and founder of South Carolina for Criminal Justice Reform. I'm also a criminal defense attorney, and I'm a proud former public defender. So, Donna and I both working in different ways within the criminal justice system have seen how there's this revolving door, right, of the criminal justice system in terms of people, they commit a crime, or they're charged with a crime, they're convicted, they maybe go to jail, they go to prison, they get out, and what happens, they come back so quickly. I remember times when I was a public defender, there would be clients that would come back 3-4 times, sometimes within a year. And a big problem with that is that people are unable to get back on their feet after they've been incarcerated, or after they've had adverse effects of having a criminal conviction or having a pending charge, that they end up resorting to crime again. So when you can't get a job because of your conviction, because of your criminal history, whether in the public sector or in the private sector, and you can't get a business license, there really aren't that many options for you. And that especially happens, right, Donna, when it comes to people that have mental health issues or substance use issues, right?
Yeah, absolutely. We talked a little bit about that yesterday, how many people complete recovery after substance use issues and, have to return to the same environment they were in, and looking for employment and finding employment sometimes, but not finding employment that gives them like a reasonable wage that they can actually live on. So a lot of times people will seek to, start a business in addition to what they're doing, so they can work and kind of supplement that income. And so when they don't have that ability, it's really unfair, and you're not giving people a really good chance to start again. So we're excited about that bill for sure.
Yeah, I think we're going to make another trip back there, right, Donna?
I think so. Yeah, absolutely.
Join us, and any of y'all are welcome to come. I think the coolest thing, this was my first time testifying before a committee. I know it was also yours, Donna, and it was so much less intimidating than I thought. Don't you think?
Yeah, it was really easy, actually. I was pretty nervous, but after we got going, it was kind of like, oh, we're just talking, and to have an opportunity to kind of educate people about what we do and to see things from our perspective, because, how many times do they actually get to hear from somebody who's been in the field with like substance use and mental health and a criminal defense attorney and hear that perspective. So it was pretty cool to be able to do that.
Yeah, and people that are directly impacted by it, Lester Young, who we love, who's founded Path to Redemption. He was formerly incarcerated, and he made such an impactful and passionate testimony yesterday. But it just showed me, it taught me that, even as an attorney or just as a citizen, how easy it is to go and testify before your government, to tell the senators how you feel about something, how you were personally impacted, how you don't agree with something or you do agree with something. So if any of y'all are interested in doing that, we'd be happy to share the little that we've learned so far, or at least direct you to someone that may be able to help you navigate that system. Because once you learn how to do it, it's really rather simple and it's very fulfilling and fun, I thought.
Yeah.
So that was fun. We had a great time in Columbia. Our research director, Philip Berry, who's at USC, as y'all know, showed us around the campus. We got a picture with what, I don't know, all the USC alums are going to hate me because I don't remember the name of the Gamecock mascot. Oh, this is bad. This is bad. Donna, do you remember? Philip's going to kill us when he listens to this.
Hockey, maybe?
I don't know. I think it might have been coffee. I don't know. But we got pictures. We had a great time. Had lunch at a Mexican place. It was Cinco de Mayo. But meanwhile, Donna, while we were so excited about the progress that all of us were making, what was going on? There was a vote taking place in the House of Representatives regarding the death penalty legislation that we have been educating the public about for the last few months, and very, very sadly and tragically, it was passed by a majority vote in the House. So what are we talking about? This is Senate Bill 200. And if you've been listening to our shows the past few months, we've been hosting many different experts from this state and from across the country. Justice 360 came on, senators from Virginia came on and told us about how they abolished the death penalty in Virginia just in February. We heard from Frank Knack and the ACLU, South Carolina ACLU director, about what the problems are with the death penalty. And, you know, despite this huge wave that we've been having the last few years, but especially last summer with the death of George Floyd for criminal justice reform, we have been moving in the opposite direction here in South Carolina regarding the death penalty, sadly. And this bill, what it does is makes the default method of execution in South Carolina the electric chair, and it also adds the firing squad. So how does the death penalty work right now in South Carolina? Well, there's two options if you're sentenced to death for how you would be executed. One is lethal injection. That was instituted in 1995, where people on death row could opt for lethal injection as opposed to the electric chair. But the last execution we had was in 2011. And the reason for that is because South Carolina, like many other states, does not have the lethal injection drugs for execution. Pharmaceutical companies do not want to sell drugs to be used for lethal injection anymore because of the clear controversy that occurs regarding it. So now, you know, state senators and House representatives have been pushing this bill to try and get the death penalty back into motion here. And the way to do that, they've decided, was to institute a different method of execution that basically requires people to be executed by the electric chair firing squad if lethal injection is not available, which we know it is not available. It likely will not become available, and it has not been available for several years. You know, why is this bad? We've talked about this, and you're welcome to go back to some of our other episodes, and maybe we'll upload some to the podcast here. Why is the death penalty bad? Well, because our system is flawed, right? I think we all know that, those that are listening here. We don't have a perfect system. The Innocence Project, as of this year, has exonerated over 375 people that were on death row. That means these were people that were convicted of a crime, sentenced to death, and then it was later found out that they were actually innocent of that crime. So to be sentenced to death and then executed, this is the final move. There was, you know, talk yesterday and some representatives saying that we're playing God, referencing, you know, the abortion bill that was just passed, and we don't want to play God, yet we're doing it here in a flawed system. Yeah. You know, the electric chair, we are one of 8 states to allow the electric chair as a method of execution in the United States. That includes Alabama, Arkansas, Florida, Kentucky, Mississippi, Oklahoma, Tennessee, and of course, South Carolina. And then before this bill, there were only three other states that actually allowed the firing squad. That was Mississippi, Oklahoma, Utah, and now South Carolina is making it the fourth. The electric chair, if you don't know, it forces over 2,000 volts of electricity into the body. That's equal to over 160 car voltage from car batteries, if you can imagine. We've got a dark history here in South Carolina regarding electrocution. You know, the youngest person ever to be executed by electric chair was George Stinney. He was 14 years old when he was executed, and that was here in South Carolina in 1944. So of course, here at South Carolina for criminal justice reform, we do not believe in execution as a means of punishment. In our criminal justice system in this state or any other state, we are for the abolition of the death penalty, and we do not support, obviously, this bill. And we're very disappointed that it looks like it is going to be finally passed here. The Senate voted in an overwhelming majority for this bill back in March. I think they voted 32-11 back in March, and now and the House just voted it. But it's really sad, isn't it, Donna?
It is. It's pretty awful. I mean, when you think about it, and I was looking at some articles earlier today and how people are, like you said, drawing the contrast between the abortion, you know, how people are looking at abortion and how people are looking at the death penalty. And it's just really amazing that, I don't know, I can't put into words this day and age that we've taken such a step backwards to allow such barbaric practices to be okay. I can't really express how I feel about it. It's insane. Like, it's hard to gather. It's hard to believe.
I mean, we were really sad when we even heard of this bill even being pushed, and now this is just even worse. We anticipated it getting passed just because of the makeup of the legislature right now, but to actually see it go through is very disappointing. So we felt it was important to discuss that today. Of course, there's probably people listening that may not agree with us on this issue. We welcome you to come on and chat with us. And, you know, one of the big arguments that a lot of proponents of the death penalty say is this lack of closure for the families of victims, right? That is one thing that they really push a lot. They talk about how the families of victims have been waiting for years, decades to have some kind of closure. And I know, Donna, you talk about that issue a lot regarding mental health.
Yeah, you know, there's not really an evidence that shows that it provides any closure for anyone. If anything, I think a lot of times people think they're going to get some type of closure from it, and it's actually pretty traumatic. I mean, if you watch someone take their last breath, it's not a lot of relief in that. But the belief is that it is, and I'm not going to say it's not for some people. You know, some people may feel a sense of relief from that, but a lot of people find that it's not, and so.
Yeah, and some, you know, one of the representatives, let me see which representative it was. I don't want to get his name wrong. I have it here. But was talking about, you know, if you are voting for this bill, then you are basically putting your finger on the button for the electric chair. You know, currently they don't film executions. They don't broadcast them, obviously, but one of the representatives was saying, you know what, if we're going to be executing that people, let's broadcast it, because people should see what we're actually doing to our citizens, regardless of, you know, how you feel about it. It is very traumatic. You know, I've been a few times, I actually went to death row in different states and saw the old Sparky, and it was just disturbing to even be in that room. That's set up almost like a movie theater where people watch a show and see someone being murdered by the government. So it's I can't imagine what it would be like to actually witness that. I know there's a lot of lawyers and family members and different professionals that do have to go, but I can't imagine doing that. Well, let's stop talking about the sad parts and let's start being a little bit more hopeful here, Donna. And who better to talk to us in times of despair than Donna White and her illustrious guest here. But Donna, tell us what we're going to be focusing on this month.
So the month of May is Mental Health Awareness Month, and I get really excited about Mental Health Awareness Month because anybody that knows me knows that I'm passionate about mental health. I talk about mental health all the time. I think there's been this idea that people seek treatment when there's something wrong. And I talk a lot about not waiting until something's wrong, but like mental health treatment can be preventative care. If you have a headache for a couple of days, you don't wait you don't wait till you have a headache for like a whole month before you go to the doctor. Usually people are like, okay, I've had this headache for a little while, I need to go get it checked out. So I talk about feelings in the same way. If there's a feeling or something doesn't feel quite right, or you're a little bit off, why not check in and see how you're feeling? So today I'm really excited to talk about our guest that we have. Our illustrious guest for today is Mr. Lamar Suber. He is the current program manager for co-occurring programs within the South Carolina Department of Mental Health and the South Carolina Department of Alcohol and Other Drug Abuse Services. He also oversees or is involved in numerous joint projects between the two agencies, including the South Carolina Hopes Project, which is what we're going to talk about today. And Lamar has been involved in the mental health and addictions field for 10 years. So we are super excited to have him. I think it's really important that we talk with him today about the SC Hopes. I'm excited about SC Hopes. I haven't, it's out there. I think some people are aware that it's a thing, but there are a lot of people that don't know about SC Hopes and what it is. So that's what we're going to talk about today. And I think it's fitting, we just kind of covered all of the sad things. I mean, within the last year, we've had COVID, we've had a whole pandemic that no one was ever prepared for. People were stuck in their homes. We were running out of toilet paper. We were hoarding meat and toilet paper, because we had to. It was insane. So it was just a different time of year. In the midst of all of that, we saw a lot of things in the news about excessive use of force. There was George Floyd. There's been the incident. There's also, now been the trial. We just got finished talking about the death penalty in South Carolina. So people are impacted, and people are seeing this from a lot of different perspectives. And I talk a lot about vicarious trauma. And for those of you that don't know what that is, it means you don't have to directly be impacted by something for it to be traumatic. You can witness it, you can see it, and it impacts you in a different way. So I am excited to have Mr. Suber here so we can talk to him about SC Hopes and what that is. So tell everyone about SC Hopes and how amazing it is.
Well, first, I would like to say hello, everyone. Thank you for allowing me to come in and speak. It is definitely a great opportunity, and I truly appreciate it. Now, to talk a little bit about SC Hopes, this is a project that I'm spearheading. That's a joint project between the Department of Mental Health and the Department of Alcohol and Other Drug Abuse Services. This was actually birthed out of a grant that was given to South Carolina and several other states from the Substance Abuse and Mental Health Services Administration, which is the federal administration that oversees how different substance abuse and mental health entities work throughout the country. So this was an emergency grant due to COVID that was handed to several states. And the task of this grant was to either initiate or enhance crisis services geared towards those that are seeking mental health treatment or those that are seeking substance abuse treatment. So this was something that was started in 2020. It's been over a year since this project has been birthed. And I am excited because we have yet another year to go. It is slated to end in August of 2022. So we have all of this time for people to go ahead and get involved. And there are several things that I would like to highlight as far as some of the programs that we offer through SC Hopes. Now, you hear SC Hopes and you're just like, oh, that sounds very genuine and very nice. And it is. It's very warm. It's very fuzzy. And it's there to make sure that the people of South Carolina are receiving all of the services that they would like to have, either in the mental health field or the addictions field. One of our main components is our call-in, resource, and referral line, which is affectionately known as SC Hopes. You can call in anytime, day or night, and speak to a trained clinician that is there to either give you resources in your local area. And when you think about resources, you're talking about food banks, you're talking about COVID testing sites, maybe vaccine locations, anything that it is that you're trying to see in your local area, or you can be connected to treatment services, so through mental health or to addiction services. Just so I can plug it in real quick, the number for SC Hopes is 844-724-6737. So it's literally 844 SC Hopes. So I'll repeat it one more time so everybody can get it. 844-724-6737. So if you call into the line, again, anytime, day or night, you'll speak to a clinician and they'll connect you to what it is that you're seeking. That's our biggest project that was birthed out of SC Hopes, was the call-in line. However, there are several other components that I would like to highlight just briefly and really quick. I don't want to take up too much time. One of our components that I so love and have affectionately came up with the name of myself, if I could brag just a little bit, is our HOT team, which stands for—
I like the sound of that. I like the sound of that, Lamar.
It stands for our healthcare outreach team. When we were brainstorming about this, I was like, what is an acronym that we could use? And I said, you know what? HOT. We could just use HOT. And if you think about it, in essence, if you're going through a COVID crisis and you're a healthcare worker, and things are going to get a little intense, things are going to get quote unquote hot. So this healthcare outreach team is designed to help those that are in the healthcare field, providing direct healthcare services with linkage to treatment for addictions and mental health. It is comprised of a 3-person team. There's a licensed addiction clinician, a licensed mental health clinician, and a psychiatrist that can help those that are seeking, specifically from our healthcare field, treatment into either of those fields. What I really like about this team is that it's a small team and it allows you to have that focused care, regardless of whichever avenue you're coming into. And you're able to also tap into access for financial assistance if you would like to have your treatment covered. Let's say you have a copay or you have a deductible that you haven't met, but you qualify to be a part of this team, then you can go ahead and have that financial burden covered for you, so you can go ahead and enroll into treatment services without having to worry about the cost of a bill coming your way. Another thing that I would like to highlight is our Justice Involved program. So we have set aside funds from the grant to help those who are reintegrating into their communities due to COVID. So if you've been released from a detention center or a jail in South Carolina, you're trying to reintegrate into your community, and your release was more than likely due to reasons because of COVID. Maybe they're trying to physically distance people in the detention center or the jail. Perhaps there was a loved one that was very close that passed away, and they're granting early leave to go and maybe reintegrate back into the community. You can come into one of our mental health centers and you can be seen by one of our Justice Involved liaisons who will help to guide you through the process of reintegration. So we're talking about case management services, we're talking about financial assistance for your treatment services, and if you were on any psychiatric medication while you were in a jail or a detention center, you can have up to at least 30 days worth of your medication covered free of charge, so that way you can continue on with your regimen without having to worry about going to see a psychiatrist or going to an emergency room and getting an emergency emergency script for any of the medications that you have. Because one thing that I can speak of just from working with those liaisons is that a lot of times we have people that are reintegrating into the community, and they, from what I've been told, have not been given all of the resources necessary for them to properly be able to reintegrate back into the community. So our justice involved liaisons at DMH are there to, as that stepping stone, if you will, to kind of help guide people and give them some of the resources that they might need or are seeking to help them have a smoother transition back into their community.
That is and there really aren't, and I'm sure you've heard stories from people that have been reintegrating from prisons or jails due to COVID, but there really isn't a proper, sufficient system in place for reintegration for people with mental illness right now, right? The prisons aren't able at this point to provide medications for everyone 30 days or even less sometimes after they are released from incarceration.
Yeah, and I think what happens a lot of time is, I would say, communication. Whenever there's a breakdown in communication, whether that's in treatment services, whether that's in having someone getting set up to be reintegrated back into the community, if the communication is not there between inside and outside entities, then I could see how a lot of people are leaving and they're not getting those services and or those materials that they need in order for them to reintegrate. So from what I've seen, there isn't always a clear, straight cut path from being in a detention center or a jail, going back into the community and having everything that it is that you need in order to be successful. And that's why I'm very proud of this service that we offer, because even though we're not able to offer every single thing that someone may need, we can at least offer something so that way you have that connection piece back into your community, and you have that treatment ongoing for yourself so that way you can become a happier you in the community that you're going back to. And one more thing I want to highlight just really quickly. If you are seeking services at one of our mental health service centers or clinics, and maybe right now you're struggling financially. I mean, we've all been going through an up and down time over the last year with the pandemic. We've seen multiple people lose their jobs. We've seen companies close. To be honest, cash is strapped all over the place. One of the things that SC Hope provides, if you're seeking mental health services, is we provide that financial assistance piece, similar to what those healthcare workers are receiving as well. You can come into one of our centers, into one of our clinics, and if you are experiencing new or increased mental health symptoms, and it's related to the COVID pandemic, we will go ahead and set you up to make sure that you do not receive a bill when you're coming in for treatment services. We want to make sure that we're able to cover everything from the time you walk in and get your intake assessment done, to speaking with a therapist, even being evaluated by a psychiatrist. We want to make sure that that's covered. So we offer that at all of our mental health centers and clinics to anyone who is able to enroll into our program for SC Hopes.
That's fantastic. I mean, I imagine, well, I think we know based on people that at least I've represented and Donna that's helped, leaving an institution, whether it's a jail or a prison, that transition is traumatic for many people, even if they don't have any kind of diagnosed mental illness, right? So what kind of hardships can people with mental health disorders encounter when reentering the community without such kind of services?
Well, when you're thinking about different hardships that could happen just across the board, if you are facing a traumatic event, that causes a lot of stress, that causes a lot of anxiety. People may not necessarily know how to handle certain situations that others may find normal, quote unquote. They might see them as hard and difficult. So when you're looking at the population that we've serviced across the mental health field for DMH, you're looking at people coming in with not able to have access to a job, or not able to have access to housing, to proper food sources. These are just some of the different things that people face as hardships as they're reintegrating back into the community. And I would like to highlight that at DMH, that's why we have those justice involved liaisons, because again, even though we're not able to provide everything, we can't provide you with a house right away. We can't provide you with food exactly right then and there, but we can link you to all of these services that are able to help you get on that right path, as well as provide you the mental health treatment that we can provide for you to just process through everything that's been going on for you.
Lamar, we got a question from our live feed. Someone was asking, where are the clinics located?
So we have centers and clinics in all 46 counties across South Carolina. Usually they're in the major cities of South Carolina, and please do not quote me. I am not a native South Carolinian. I am recently moved here as of a couple of years ago, so I'm still learning all of the different areas and lingos of different places, but we do have at least one structure in all counties throughout South Carolina.
That's great. And we'll put a link to that in our feed and on the social media too, so everyone can link to the website, which I'm sure says where the clinics are. Right, Lamar? Awesome.
Yes.
Lamar, I wanted to ask you a little bit more about the SC Hope Hotline. So the SC Hope's hotline, where people can call in. We were talking a little bit earlier about, just all the stress and anxiety that people have been dealing with. So what can people expect if they call that number? Because you gave that number earlier. I think you said it was 1-800-SC-HOPES, right?
1-844-SC.
1-844. See,
yes.
That's why I asked. 1-844-S, and I wrote it down and still didn't get it right. It was 1-844-SC-HOPES. So when people call that number, because we want to encourage people to call it, what can they expect? And what is a call? What is a typical call like? Like, who can they expect to be on the other end? What does that phone call feel like for people?
So we actually have been partnering with an additional grant that the Department of Mental Health has received through FEMA and SAMHSA, which has been dealing with different crises that have been happening throughout South Carolina. So it started last year when we had several tornadoes that ravaged through 9 counties in South Carolina, and then it extended into the COVID pandemic. But when you call in, you will receive a person that's a trained crisis counselor that'll be there to answer any questions that you may have in regards to resources that you're seeking, or if you just need to talk to someone and you're not quite sure where it is that you would like to go, or if you need help and you're just not sure where to turn to, we can then provide referrals to different entities. Some of those entities would include some of the mental health centers, some of the mental health clinics, some of the addictions agencies throughout South Carolina, and then any other entity that you may need in order for you to have all of your needs met. So usually from my understanding, from talking to the crisis counselors, calls can last anywhere between a couple of minutes up to half an hour. It really just depends on what it is that you need and what it is that we can provide you to make sure that you're leaving us happier than you came, I should say.
Cool. And earlier I also mentioned, again, going back to everything that's going on, but you said, if people wanted to call and, have somebody to talk to or find those resources. So how would people know, like, as a person just in the community, if I wasn't a therapist, like, how would I know if I had these feelings or if they were different, or how would I know if something was wrong or off? Like, how does that, would you tell somebody to kind of check in with themselves to kind of figure out what they might need?
Well, I always think about my training as a therapist as well. And what I used to tell my clients or ask my clients is, what's happening in your daily routine and what's changed?
Yeah.
So if you think about it, if you're a person that wakes up every morning at 7 o'clock, you get dressed, you have your breakfast, you go to work, and then out of nowhere, you're missing your alarm clock every day or hitting snooze all the time. You're coming to work stressed and tired, and it may not even be anything that's happening at home, but you just feel like the weight of the world is on you. Maybe you're not eating the way that you were eating before. Maybe you're having more vivid nightmares or dreams. than you were before. And this is something that started and has remained consistent and persistent. Then maybe that's something you should look at in terms of checking in with yourself and saying, what's happening? I don't feel myself. I don't see the same person, and I'm noticing a change. But on the converse side of that, sometimes we don't even know that these things are happening to us. We chalk it off to, oh, it's just the job, or it's the kids, or it's Joey. He's always telling me about, having dinner ready, or, whatever the case may be.
Yeah.
Okay. Are other people noticing some of these things that are happening? Did you have a conversation with maybe a loved one or a coworker, and they've said something along the lines of, I've noticed lately you're looking really tired, or we always go out to eat lunch and now you're not eating lunch anymore. You always, used to at least Zoom call with us after work. You're not even on the Zoom calls anymore. Those two could be signs and ways to kind of identify that there's something that has changed. Yeah. And maybe that's something that you can check in on.
And that's interesting you say that, because I know a lot of people, I encourage people not to Google their symptoms, right? Like it's so easy to be like, what does this mean? And why do I feel like this? So is there a test or a survey or anything that people can use to like check in with those symptoms that you would suggest to anyone?
Yes, actually, the Department of Mental Health has partnered with the American Foundation for Suicide Prevention and also the Department of Alcohol and Drug Abuse Services to create a survey that we host on the DAODIS and DMH website. It's called the Hope Connects You survey. This survey is a self-assessment that anyone in South Carolina ages 18 or over can access, and they can take the self-assessment to see where it is in terms of their mental health and or any addictions issues they are in their life at that current time. The cool thing that I love about this survey is that you can take the survey anonymously. So you don't have to put in any identifying information, and you don't have to worry about anyone trying to reach back out to you to say, we're going to get you, or something of that nature. This is an anonymous survey for you to take to be able to see where you are. It's free of charge. And if you want to, you can also be connected to a clinician who can then be able to refer you to different resources based on some of the things that you've answered in the survey. You can also chat anonymously with this person. There is a turnaround period, about a 24-hour or a business day turnaround period, that you might receive a response back, as we know that people are busy. However, you can have this conversation to see if there's other things that you would like to discuss and or other services that you can access outside of what they might recommend to you, if that's something that you're seeking.
So Lamar, we've got, our audience is so wide ranging here. We've got people that have been victims of the criminal justice system, that are re-entering society, that have re-entered society. We've got people that work in the system or around the system, whether in healthcare or in the criminal justice system. But especially for our viewers that are going to be listening, or listeners that are going to be listening to this later on the podcast, there's a lot of legal professionals. Even if you don't think that you witnessed or had secondary witnessing to a traumatic event, you can still have symptoms of, mental health issues, depression, anxiety, right? Even if, let's say, you have got a great job, got a great family, but like Donna said, this year has been tough. What do you say to people in terms of that stigma of trying to maybe reach out for mental health? Especially if maybe you're a professional and you think, well, my life's good, I shouldn't be upset.
Well, one thing I want to refer back to is what Donna had said earlier, is this idea and the concept of vicarious trauma. A lot of us experience this in our lives, and we don't realize that this is something that's happening to us. And I would say that experiencing the COVID pandemic has been a huge vicarious trauma for everyone. Whether that's you either experiencing it through the eyes of someone else, watching it on the news, whatever the case may be. We've all had some kind of trauma that has happened to us. And there's no shame in talking to somebody and telling them, these are some of the things that I've been seeing and it's really bothering me. Or these are some of the things that I've heard and it's really affecting me. I think one of the things that we always kind of shame in America as a society is the fact of having, quote unquote, I guess, weakness is what people would say. And I say that with quotes because from what I've been told, and I can speak from personal experience just in my own family, being a Black man coming from a family that was raised in the South, you did not talk about mental health. Mental health was something that was stricken from the record. It was shunned away. You were told to pray it away, go to church, get right with God, and you'll be fine. And even though turning to a religious source or a higher being is a great source of that emotional and physical connection, it doesn't necessarily take away from what might be happening for you physically and or mentally. So I always say, reach out to somebody somewhere, talk about the things that are happening for you and allow them to give you some advice. And I always tell people, especially my clients who've been hesitant, think of this as advice. You can take it and you can run with it, or you don't have to take it, and that's completely fine. But we can all use a little bit of advice every now and then. So have some advice.
Lamar, one of the things that have come up recently, like I said, within the last year, there's been a lot of talk about it. I mean, even before then, there have been some articles and things written about witnessing the violence that has happened, with the excessive use of force and police officers. There's been a lot of talk about how that impacts people, how that impacts communities as a whole. We were talking about the vicarious trauma, and I think it's more in our faces now more than ever with social media. All it takes is someone to take out a phone and there's a video and it's all over the news, and sometimes it's replayed. Personally, I know, like with the George Floyd case, that was something that, personally I found to be very traumatic. I didn't watch it until actually a couple of months ago. It was the first time I ever watched it, because I absolutely refused, because I know myself, I know my boundaries, and I was like, that's not something that would be good for me to watch. And so knowing the impact of videos like that, like what would you suggest to people, or, how do you feel like that really impacts people?
Well, I will say this, I can't give a overview of everything that people would feel or need in terms of experiencing this vicarious trauma, but I can say this much, that at the Department of Mental Health, we do have a trauma-informed care system where we treat people who have experienced things such as vicarious trauma and or traumatic events. All of our clinicians are gone through strenuous training where they learn about the different types of trauma, how to respond to trauma, how to treat trauma, and then also how to be empathetic in a way that's going to allow for the person who experienced it to know that they can be cared for in the moment and afterwards. And so I tell people all the time, we at DMH are trying our best to help address all of the vicarious trauma and or traumas that have been happening, stemming from last year all the way up until now. It's a lot.
And excuse me for not knowing this, but does the Department of Mental Health oversee mental health treatment of the incarcerated in the South Carolina Department of Corrections and the prison system?
So to my knowledge, no, the Department of Mental Health does not oversee treatment of those that are incarcerated. We only connect in certain instances to coordinate services when they're being released and coming back and integrating into their communities. That's kind of where we pick the baton up and run with it.
Well, I have greatly enjoyed this conversation, Lamar. I've learned so much. I hope that our viewers and our listeners have as well. I can't thank you enough from our organization. I know Donna wants to thank you too, but thank you so much for what you do, for educating us on these important issues and for getting out into these communities. I will say that in some of our live feed, there's been some concern from some of people watching. How do we inform the more rural communities about these? There's been some concerns that rural communities are really ignored when it comes to some of these services. Are you all trying to reach out to those? What can you do, or what can we do to help people in these communities?
I'm actually glad that that was brought up because that's something that almost slipped my mind. We actually have established a program called the Highway to Hope program. This is a program where all of our mental health centers are purchasing RVs that are going to actually house mental health clinicians and primary care physicians to travel into the rural communities of South Carolina and provide them with those services. We are currently working on trying to get an addictions clinician on these RVs as well. So that way is the complete gamut of at least those primary care services available in the rural areas. So that's one way that we're trying to reach out to the rural communities and making sure that they not only receive the treatment, but then also know about the different programs that we have. And just to kind of tarry it all back to SC Hopes, I know that we are trying to also reach out to the rural communities by doing a lot of our canvassing efforts. So we have people that have been going into different communities across the state, more of the rural communities, and just telling them about what SC Hopes is, checking in on people, asking them if there's any needs that they have and how we can assist. And that's a part of the SC Hopes process outside of the office, outside of the line that we have. It's just making sure that we have people actually meeting people, even though they're not like face-to-face in terms of how we normally would be. They're physically distanced. They're still there to provide some in-person help if needed. So we have that as well in the rural communities throughout South Carolina.
That's really great to hear. And I'm glad that whoever asked that question in the chat box asked it as well, because a lot of times the rural communities do, get left out. They're way out there in the middle of nowhere, and we kind of forget they exist, but it's good. It's good to hear those programs. So again, like Allie said, I am so excited that you were able to join us, and thank you for being here and sharing all of your information. Want to make sure that people know that that number is 1-844 SC Hopes. I got it right this time, 1-844 SC Hopes, and I think that's going to be included in the chat box if it's not already been included. So again, we want to thank our guest, Mr. Lamar Suber. We're hoping that you guys will come back and join us next week, and we will have our guest from NAMI on next week. So that's the National Alliance on Mental Illness. They will be joining us and talking a little bit about what they do as well. So we're hoping just to provide our community members with a lot of information about resources. Speaking of resources, we also on our website, SC4CJR.org, we have a resource list available. And so that resource list can be used by anybody. So I know we're doing our podcast today. So we have attorneys and lawyers and judges and other people listening in. That resource list can be used by anyone. So if you are in need of services or want to see what's available in your county, you can look at that resource list. So we're excited about that. Again, if you want to follow us on social media, you can find us at SC4CJR. We're on Facebook, Twitter, Instagram, YouTube, and we're trying to do a little bit with TikTok. Allie and I were throwing around ideas yesterday in the car. We think we're hilarious. We don't know if anybody else will. So maybe you'll see us do some silly things on TikTok in the future. And I'm going to kick it back to Allie because I want to make sure I don't miss anything as we're wrapping up.
No, and also follow the Direct Examination podcast. You can listen to the podcast on Apple Podcasts and also follow on the Facebook page. We want to thank again Dane, Joseph, and Amber for allowing SC4CJR to use their platform this summer. We've got a lot of interesting and amazing guests, just like Lamar, that are going to be joining us in the coming weeks. So keep a heads up and please like, share, subscribe. Thank you so much, Lamar. Thank you,
No,
Don.
thank you.
We'll see y'all next week. Have a great night.
Next week. Have a good one.